Hi everybody. So this is Footsteps to Fertility and I'm Dr. Wanjiro. We're on our second part of the series on Men's Health Month where we're talking about men's infertility. Today we're going to be talking about what the causes are. I know that a lot of men are suffering with a diagnosis and wondering what the causes are. I just want to be clear that sometimes we have no idea, but sometimes we do. So if you want to know what some of the causes could be, keep watching. What are the causes of male infertility? For men, the only element we're really interested about is the sperm, because a healthy, mature sperm needs to look a certain way, it needs to move a certain way, and they need to be enough to move from the birth canal all the way into the fallopian tube, which is a small distance if you think about it, but a really long distance for a microscopic element that can't even be seen on that can only be seen on a microscope to move at least 10 to 15 centimeters. So what are the causes? Number one cause is genetics. For some men, it's unfortunate. There may have been a problem in the genetic makeup in the chromosomes as they were in utero, and for some, there's just no sperm. And even when we do testicular biopsies to look, we find that there was no sperm produced. Another cause of genetics could be sometimes the vas deferens, which is the tubes that move the sperm from the testis outside into the urethra, were never formed, and that's another genetic defect that could happen for some men, unfortunately. So our second and most important, I think, cause of male infertility is lifestyle. We are affecting our own bodies these days. We're drinking more, we're smoking more, we're into drug use like Mira, like Bangi, like all these things that we're now starting to see in our environment. What this does, they are toxins and they affect our sperm. So what we're seeing is that the sperm are slower, their morphology has changed, they look a certain way. And if we just stop these habits, we could actually improve. The third cause that we have seen is sometimes there's damage to our reproductive system as a male. So for some, we have had repeat surgeries, and some of these surgeries have affected the way that we produce sperm. We've had surgery that has affected our nerves, and sometimes with that we have something we call retrograde ejaculation, where instead of the sperm going out into the urethra, it goes back into the bladder. So this damage could be caused by surgery, but there's also damage that could be caused by trauma. So some young boys have something we call testicular torsion, where the testis actually rotates on its blood vessels, and this could happen during playing games, during riding bikes. Usually occurs in about 14 years old. So this has an impact on our reproductive system, and we've seen this to be one of the causes as well. So the fourth cause is infection. And this is important. Just like a woman can have tubal blockage because of infections such as chlamydia and gonorrhea, men can also have infection damaging the vas deferens. So chlamydia and all these gonorrhea can also block the tubes of a male and cause the sperm to be able to travel from the testis to the urethra, and therefore that's the blockage part. Number 5 is some illnesses. It's important to know that some illnesses could also affect your sperm. The most important and the one that I'd like to highlight is mumps. So getting mumps as a teenager could actually damage your sperm. So it's important that if a teenager gets mumps, you need to be very wary about this and have him checked out. So mumps is one, but other diseases such as kidney failure and some hormonal diseases may also affect your number of sperm and the way they move as well. The number 6 cause is something we call varicocele, which we're finding a little bit more in men. We would say that about 40% of men who come into the clinic with having problems in the sperm have a varicocele. And what varicocele means is just like a distension of the vessels in the testicular area. And what this causes is that there is more heat in that area, and therefore we have lower numbers of sperm and we have lower motility of the sperm or movement of the sperm. I hope you've enjoyed the video and learned something about the causes of male infertility. If you are struggling with this, or if you know somebody who's struggling with this, feel free to contact us via email or any other media. If you liked the video, share it, subscribe to our YouTube channel. Let's keep learning. This is Dr. Wanjiru Ndegwa, and you're watching Footsteps to Fertility.